Thank you. I'm Dr. Will Hall, and I'm the Director for the Office of Public Policy with the Louisiana Baptist Convention. I hadn't planned to speak, except that I am a veteran, and these issues regarding veterans are very important to me. But I don't want you to make public policy based on anecdotal information. And I would just share with you one study that rejects what was just shared with you. And it was a study conducted by Yale on 2,772 veterans who had PTSD and were medicating with marijuana. And they found that marijuana use exacerbated the violence. Cause did not decrease. In fact, it increased their opioid use and also increased alcoholism among veterans that were in part of this study. So please don't be persuaded by anecdotal personal testimonies, but look hard at the research because it's very clear regarding the use of marijuana for PTSD. The other thing, Dr. Polka, I don't know if this is a perfect time, but he did raise the issue about THC-derived products, and you raised the issue about the HOPE report. And one of the deficiencies I found in the HOPE report is that you might recall that DA Warren Throckmorton, who passed, was a member of this committee, and he was able to collect some data that showed that THC adverse events among our children had risen 645% in a 2-year period. The HOPE report does not contain the data on THC adverse events among youth, and that would be very helpful, especially now that we've changed the regulations on the cannabis products and CBD products and such. And so cannabis and hemp, excuse me. And, so let's say marijuana and hemp. I mean, I guess that's how the technical term, I guess it is. They're all cannabis. So I would like the board to make a recommendation to the governor and also to the Department of Health that we mandate that all health professionals begin reporting this data on adverse THC events regarding our children, and so that we can start measuring and make good policy based on what we're finding out. I know up in Rapides we've seen a increase, a surge in children that are eating gummy products and things like that. And so I think that we need to mandate that if you're a healthcare professional, whether it's a clinic, a private practice, a hospital, that we begin sending that data in so that we can make good decisions regarding legislation moving forward.
I want you to repeat your question right quick. We're referring to the HOPE report that comes out of the Heroin and Opioid Council, and then it's run by individuals over at the Office of Behavioral Health, and I do have some individuals in the room. So I just want to repeat it, so that might be something that you can bring up at one of their board meetings to the members on. And
I have reached out to the individuals without any callbacks yet. And before the new year, I was making multiple calls.
Yeah.
But
the question about the data on youth, what was that?
Yeah,
repeat that.
We need to have any THC adverse event where a child is taken to either a medical professional or a clinic or a hospital that needs to be collected so that we can have good data moving forward on how to protect children even as we give access to adults to these products.
Anyone have any response to that question?
I have a comment.
Okay, one.
I was going to comment.
I have a question.
One second, please. 1 second. Go ahead, Lisa.
Yes, thank you. Dr. Hall, I was just going to comment that a board on which I sit, the State Child Death Review Panel, one of the things that it discusses, among the other many things of, child harm and child death, are the poisonings that come from, THC with children. And by children, we're talking about anyone under the age of 14. And so that may be, just for your reference, a group, a discussion that you want to, impact or be impacted by.
Thank you.
And they also meet quarterly, as does this board. So just, as an FYI, because clearly you have lots of information that they could benefit from, I think it would be an amazing dialogue.
And it is, if you don't know this, it is a serious problem among our youth. And I'll repeat the stat one more time. Our high school seniors are #1 in the nation in the use of alcohol, #1 in the nation in the use of injecting illicit drugs. And before we legalized medical marijuana, they were only #14 in the nation in marijuana use. I suspect because we've made access to marijuana products easier for adults, we've also done that for youth. That's typically what we see. And if you don't know, too, Colorado, Oregon, Washington, and California are all backpedaling because of their weakening laws regarding access to marijuana products because of the dramatic negative impact it's having on their youth. So the LA Times did a 10-part series, if you're not familiar with it, but even the Attorney General for Colorado led an effort to be able to limit THC to adults simply because it was causing a rocketing among of problems among their youth. So, thank you.
Thank you for your comment. Any response?